Good morning, everyone. My name is Abron, and I'd like to welcome everyone to IAD's webinar today. We're going to be talking about the National Care Dental / MetLife's new dental plan. We have Jesse Cranmer, and that's Cranmer, who's going to be coming with all the information. You guys are all muted, and if you have a question, just type it into the Q&A section and we will make sure that they're all answered. We are recording this webinar, so I'll send it out to everyone after, like over the next probably couple of days. So Jesse, are you ready?
I'm ready. Thank you, Cass.
All right, go right ahead.
Let me get in here and share my screen. Very good. So as Cass said, I am Jesse Cranmer and I'm with NCD. I'm an account executive. And we're going to talk about our newest, most exciting dental plan today through MetLife. All right. So there will be, like I said, put your questions in the chat box at the end. There will be a little bit of time. We'll answer those questions for you. This should take about 30 to 40 minutes or so. I'll run through it fairly quickly, but put your questions in there and we'll get those answered. All right, so a little back history. NCD, we previously had a plan, NCD by Nationwide. A lot of you are probably familiar with that plan. We have recently rolled out a new plan with MetLife. We rolled this out right in the middle of AEP, so great timing on our part, but it didn't really take flight. Everybody was busy with AEP, so this first quarter, we really started to push it, and I'm glad to be able to put it in front of you guys. So I always like to start with our mission statement. NCD exists to improve lives by driving better health, exceptional experience, and spreading the smile. So we live by this every day. It's very important for our company to adhere to our mission statement there. All right, so common things that we hear from agents on a day-to-day basis on why or why not they sell dental. Some agents say it takes too long to sell, or it's too complicated to understand or sell. Their customers don't ask for it, or the commissions also, they don't move the needle for the agent. They don't make them enough money, and it's not their primary focus. These are some common misconceptions. But we're here to tell you that it is worth your time. We have streamlined the process on everything within the NCD to make it quick, easy, and efficient. So you're going to receive an enrollment portal. You're going to receive training. And so we're here to help you any way that we possibly can. By the end of this, our time together, you'll understand each of our plans and how to sell to your current market. We built this plan with MetLife. It's the biggest individual plan on the dental market with $10,000 for annual benefit. It's the largest one out there. We also have what we claim as the best commissions in the dental industry. We pay level for the life of the policy. Our street level agents receive 21% for the life of the policy. So with our average persistency for a dental plan of over 3 years, you can make a lifetime earning on each client of over $500 per sale. With that level commission, it will help you build lifetime enterprise value, build up an additional recurring revenue stream. So you can live off the book of business, or when you go to sell it, likely you will receive more in terms of how much you receive when you sell your book of business due to level commissions. All right, how to sell. So our statistics show that on average, agents will be asked for a dental plan for once for every 12 Medicare policies that they sell, or core policies that they sell. So the key here is you have to ask for the sale. So weave it into the discovery portion of your sales process to foreshadow the dental and vision conversation you'll soon have. So ask questions throughout your meetings with your clients, and make it a priority to discuss dental and vision with your clients. It's part of their total health. So it's something that they're probably not thinking about when they're looking at their Medicare, but it's something that as an insurance advisor, you're going to want to bring it up and discuss it with your clients. So again, you have to ask the question. A popular phrase that we would like to use here at NCD is, do you have 5 minutes for me to tell you about my best dental plan? Opens the door. In 5 minutes, you should be able to discuss this plan. And then if they're interested, another 5 minutes, you could enroll them. Super easy. But our best agents that get in the habit of asking, they turn their ratio from 12 to 1 into more like every other client that they talk to, they sell a dental plan to. All right. So what else have we done? We built a world-class member experience. So we know how important it is to take care of your clients. And so we've built a world-class member experience. We actively screen for positive employees. We also have strong fulfillment. They get an email and hard ID cards in the mail. So when they sign up, they get the emailed packet, but they also get the full packet with the hard glossy ID cards. We strive to have first call resolution with all inbound phone calls to our member team answered in under 30 seconds is the goal. Our member support team also makes 10,000 outbound phone calls to new clients every single month, welcome calls. So they're calling your clients after they enroll. They're welcoming them to NCD. They're discussing the plan, and they'll go even up to the point of helping them schedule their first appointment with their provider. So they're here to assist your clients. So this is an example of the member journey that they can expect to go through. So agent facilitates the enrollment, and then we take over from there. So we'll send them their welcome packet in their email and their hard ID cards in the regular mail, like I just discussed before. We'll perform that welcome phone call, 3 attempts, to get in contact with that client before, abandoning that. But we actively try to get them on the phone, welcome them. They'll get a birthday call and an anniversary call. That's our member support. We also have great agent support. So agent support with a smile. Agent support answers all inbound calls also within 30 seconds. The average is actually around 18 seconds at this point, but the 30 seconds is the standard they're held to. They all reply to all emails within 1 business hour. That's the average on that is around 38 minutes turnaround time. If you email agent support, you'll get a response. Like I said before, we pay strong commissions, level for life commissions, helping to build lucrative lifetime enterprise value. You'll each receive a client-facing personal URL agent portal. So, you'll also receive back office access to your book of business. And lastly, we built these plans as the most broker-centric plans available on the industry. We worked with all of our agents to build this new plan with the client in mind. Our previous plan was built mostly to sell through call centers. It was easy to quote, easy to issue. It's the same rate in every single state. It was mostly built for a call center type of sales environment. This plan, we worked with our agents to build it exclusively from what we're hearing from agents on what clients are wanting their plan to look like. So how are we differentiated? So strongest benefits on the market, like I said, a $10,000 maximum individual plan is the biggest individual plan on the market. No waiting periods on that particular plan, with a lifetime deductible as well. We'll get into more details on what that means further in the slides. Simple process, easy quoting, quick enrollment, easy to market, speedy agent support, phenomenal member care. Everything is simple. And then also instant brand equity. So your clients probably have never heard of NCD. A lot of agents have not heard of NCD. We were formerly National Care Dental. Now we're NCD. but your clients are going to know the companies that we help represent. We are a program management company, so we build products with big carriers and we bring them to market on a split risk. So names like MetLife, VSP, and Nationwide are prior product. So big names that everybody knows. So where is MetLife located at? Where can you sell it at? Well, currently we're in, I believe, 39 states. This product has been on the market for a few months now, but we're actively trying to get into these additional states as they get approved by the state. You know, we'll email out to everybody that, hey, Utah is available, or New Mexico, or whatever it may be. But we're currently working to get into these remaining states, but 39 of them, big states like Texas, California, Florida, selling really well with our MetLife plan. So let's get into kind of the coverages. First and foremost, we have a little dental plan, a $750 max plan. It's the same rate in every single state, $35. The other two plans have kind of a range for the premium, $54 to $69 on our $2,000 max plan, and then $72 to $89 range for our $10,000 max plan. Now that range is zip code based rating. It is not age based rating. So it's all based off of where they live, what their zip code is. It's also worth mentioning that these plans are association based plans. So they are part of the National Wellness and Fitness Association with great benefits that come with the plan as well. So we'll get into that in more detail as well. So let's dive right into the $35, $750 max plan. Think of this plan as a plan that you would sell to a kid coming off of, that's 26 years old. I wouldn't say kid, I apologize. An individual coming off of their parents' plan, or an individual working in the gig economy like Uber or Lyft, or maybe they don't have access to a group dental plan and they just want a dental plan that's designed to give them their cleanings and their fillings, and they don't need a ton of major services. They just want to get their fillings and their cleanings done. That's what this plan was designed for. It's come with 100% preventative coverage day one. They get 2 exams, 2 cleanings, their bite wing x-rays. It comes with 50% coverage year 1, 65% coverage year 2, and 80% coverage year 3 for the basic care. And like I said, it's not designed for somebody who has a lot of damage in their mouth. So 0% coverage major care year 1, 10% year 2, and 25% year 3. So if they get into a situation where they need to use a little bit of major care, there is some in year 2 and year 3. $50 deductible per year on this plan. And then some of the association benefits that come with it. They get AlloCare Health, Road America. They get a MD hearing aid discount program. I think hearing aids starting at $399. They get LifeLock and a subscription to Prioritize Wellness. So good benefits on the association for this plan. But again, it's designed for clients that they don't need the big full dental plan, just something to get them, their cleanings and their x-rays. The next plan is our $2,000 plan. So this plan is very similar to our $10,000 plan. It comes with 100% coverage for preventative, but this time they get 3 exam cleanings and 3 exams and 3 cleanings, and then their bite wing x-rays. Basic care coming year 1, 65% coverage, 80% year 2, and 90% year 3. So most dental plans out there, they cap out at 80% coinsurance. We bumped this one up to 90% year 3. Major care, no waiting periods on this. Whoops, sorry, I've switched it. No waiting periods on this. So that's your crowns, your periodontics, your dentures, your bridges. They get 10% year 1, 50% year 2, and 60% year 3. Again, with a $50 deductible. This plan comes with association benefit Teladoc, and so your clients can call Teladoc. So if you're selling ACA, you're probably selling a high deductible health plan, and your clients, when they go see the doctor, they come out of pocket quite a bit. So instead of doing that, you can sell them this dental plan. They can call Teladoc, no copay, unlimited usage. So it's a nice little benefit that they have for this plan as well. All right, the $10,000 plan. This is the one that everybody's excited about. It's the one that sells quite a bit better than the other two plans. $10,000 in dental coverage, a huge plan. It's designed just the same as the $2,000 plan. 100% coverage, 3 exams, 3 cleanings per year. 65% year 1 basic coverage, 80% year 2 basic coverage, 90% year 3, and then the same structure for major coverage. The difference here is this plan, the $10,000 plan, does cover implants. So they have coverage for implants. And another big benefit to this plan comes with $100 lifetime deductible. So likely they will satisfy that deductible the first year. After that, they will have no further deductible as long as they have a policy. This plan also has Teladoc, Road America, MD hearing aid benefits, just like the other plan. All right, so here's some of the association benefits. So telemedicine access, clients have access to these dental plans by joining the association. But keep in mind that all of the costs for the association, all the fees for the association, they're already baked into the cost right here that we have presented, $72 to $89. All the association fees, everything's already baked into that cost. So they get hearing aid discounts, medical alert systems, moving discounts, RX programs. So a lot of great benefits. Your clients will receive details on how to access these benefits after they enroll. They'll receive an email from from the National Wellness and Fitness Association. And so they'll have access to all of their association benefits. All right, the network. The network is very large. I was talking with Cass before about this, 250,000 providers in network. So if you've been in insurance a while, you probably heard of MetLife. They're mostly known for a group insurance carrier. They've been in the group industry for quite a while. This is their first individual plan, but we are utilizing their same network. And so it's 250,000 dentists in network, with 535,000 access points. So an access point, it just means that maybe a dentist operates in multiple locations. He has different access points where you can access him. But the key benefit to remember about this network is the network discount. So if you're able to keep your client in network, MetLife offers a very large network discount, 35 to 50% off billed rates right off the top. So very lucrative to stay in network. You can access.
Let me just interrupt 1 second. Someone's asking, can you set up these plans through an EFT?
EFT banking?
Yes, banking. And the other question is there discounts on Invisalign for any of the plans?
Good question. So yes, we can set these up EFT. We take EFT and we take credit card. We'll get into kind of more of that at the back end.
Okay.
So Invisalign is not a part of this, but there is an additional benefit to these plans through Smile Direct Club, which is just a competitor of Invisalign. So they get a discount for Smile Direct Club. I think they reduced the price to like $1,900 per Smile Direct Club.
Okay, so it's discount only.
Right, exactly.
Okay, thanks.
So orthodontics likely it's not covered on a lot of dental plans. A lot of carriers consider it as cosmetics procedure. So it's not something that we typically see on any of our dental plans. So to check, if their client's dentist is in network, you can access our database here on our website, ncd.com, or with your individual personal URL, your Pearl, your enrollment portal. There is also a search built into that as well. We'll get into that as I get further along. All right, a couple things to remember about the plans. Missing tooth clause. So we have to take something out to put something in. So it could be a broken tooth, even all the way down to the root, rotten tooth, but we have to take something out to be able to put something in. So there's missing tooth clause. And then to be transparent, implant coverage, we will pay out a maximum of $3,000 per year for implants. We want to be transparent. We want to let you know that there is a limit on that procedure. Otherwise, you get into these situations where clients have a full entire implant in their mouth, and that could be $50,000, $60,000, $70,000. So we had to, for the betterment of the policy, limit the amount that we can pay per year for implants. But that means, let's just say year 2, 50% major coverages. If they go get an implant, $3,000 per year is equivalent to about 2 or 3 different implants in your mouth per year. And that's about the amount a human mouth can handle with all the healing that takes place. So $3,000 per year implant coverage on the $10,000 plan. So any questions real quick about the dental plans? I flew through that really quick.
The vision a rider or is included in these prices?
So the vision is another policy. So it's not necessarily a rider, but you can issue it on the same application with the dental plan, but it's in addition to the dental. So we do our vision through VSP providers. You're probably familiar. It's the same vision plan that we had with the nationwide product set, but we are in every single state for our vision plan except for Washington. Oregon and New York has kind of changed the plan a little bit, so it is a little different in those 2 states. And it's worth noting that the MetLife plans in the state of New York are also just a little bit different. So if you sell in the state of New York, you're going to want to visit our website and we'll get you some brochures on how it is a little bit different. But the state of New York likes to kind of step in and then change these plans sometimes. So all right, so our vision plan, it's $21 per month for an individual, and that comes with a $20 exam per year. Prescription glasses, $25 copay per year. It has a frames allowance built into it, $200 allowance per 24 months, so every 2-year allowance for new frames. VSP produces a lot of the brands like Nike, Lacoste, Calvin Klein. If the client buys one of those branded frames, there's an additional 10% allowance built in. So they would have up to $220 allowance for those brands. The lenses come with single vision, lined bifocal and trifocal lenses. A lot of our senior citizens, they don't like the lined bifocals, the lined trifocals. So it's called progressive lenses. So if they want to get those lines removed, we offer that at a $50 copay. That typically is $175 to $200. So for a $50 copay, that is a very nice benefit. Lots of other lens enhancement benefits, anti-glare, light reactive lenses, tinted lenses. All of those come with small additional copays, but are options for the client. If they want to use this plan, you can use it for contacts in lieu of glasses. There is a $150 allowance for contacts and the contact lens exam. But this is also an association-based plan. They get association benefits for it as well, from Clever Health, the MD Hearing Aid, and then Clever RX, like we discussed before. So here's the different plan for New York and Oregon. So $21 per month in New York, but Oregon decided 21 wasn't enough, so they charged $22 per month in Oregon. And very similar plan, but a few differences. $15 exam instead of the $20 exam. And then they get benefits for lenses and frames every 12 months. Frames on the previous plan were every 24 months. The other difference is the frames, they get $120 allowance every 12 months instead of $200 every 2 years. So very similar, but a little different. So that's our VSP vision plan. And so here is an example of an enrollment portal for our MetLife plan. And so as you see up here, this is my individual enrollment portal. It has my name, phone number, my email. Anytime a policy is sold using this portal, I will get credit for it. So you can take your link and you can put it on your website. You can put it in your email. You can send it out to clients. You could do a drip campaign. And if they sign up using your link, you'll get credit for it. But here is where that doc dental search is built into your enrollment portal, like I discussed before. There's also a vision doc search built in as well. This little share button, we're actively working on this to build an enhancement for the portal where you can fill out the entire application and then send it to your client by hitting share. It'll have you put in their email address and it will email them exactly where you stopped at, where they can, maybe they're leery about giving over their banking info over the phone, or maybe they just want to handle that part on their own. You can share it with them. It will save where you're at and then they can pick up and finish it off. So like I said, these are zip code based rating plans. And so you'll put in the client's zip code to figure out which one of our 6 rated zip code areas they're in. So once you plug in their zip code, you'll proceed. It'll ask you a few questions. Is the client looking for dental coverage? Yes or no? Again, you don't have to sell a dental to sell a vision, and you don't have to sell a vision to sell a dental. You can pick yes or no. So yes, let's say yes, they want to have a dental plan. Yes, they are looking for vision coverage as well. And then you need to select what the household type is. Is it just for an individual or married, a member and spouse, a member and child, or a family plan? Select which one of those and proceed. And then there are 3 options for your dental plans. So you have your $750 maximum MetLife value plan, or the 2000 essentials plan, or the $10,000 maximum dental plan. You select which one that you want and you proceed on to the quote. So here it breaks down. You've got your $750 dental plan for $34 a month. Now that's different than the rate I told you about. It's $1 cheaper. There is a small, tiny little discount for bundling these 2 together. Each one of them saves $1 per month. So it reduces the price to $34 for the dental plan and $20 for the vision plan. Again, same application, same one easy process. So you'll hit begin application. You'll proceed on to the personal primary member information. So we just need first name, last name, date of birth, gender, and billing or house information, address. It's worth noting that on our applications, we don't ask for signatures. So you're not going to have to try to chase your client down and say, hey, I need you to sign the application. We don't ask for any social security numbers. Basically, we just need the personal information and we need the banking information. And as long as we have those, you can proceed and issue the policy. So as I mentioned before, ACH is our preferred option. There are no expiration dates on a banking account. So likely retention will be better if you sign up your clients with ACH, you're aware. But we do take credit cards, all 4 major credit cards as well. So put in the banking information and hit submit. So this is kind of the summary screen, the overview screen. So once you get to this screen, you'll select effective date of the policy and then billing date. When would you like the first billing date to come out? And that's all there is. So hit submit. That's it. Very simple. So a few things that I want to mention, that I think are important for you to take down. Our phone number for our agent support. Like I said, they answer all inbound calls within 30 seconds. They're quick, they're efficient, they're trained up, and they're here to help. So 844-284-4944.
Jesse,
Yep.
can you tell us the hours?
So they are central located in central time zone in Dallas, Texas. So US based customer service. They are open 8 to 5 Central Time Zone.
Thank you.
And here's their email, agentsupport@ncd.com. As long as they receive the email within business hours, like I said, their turnaround time is quick. You'll receive a response back within 1 hour if you email them. We also have built a very, I don't know how you say, a lot of material is built into our agent launchpad. This is our agent resource website. So lots of marketing materials, brochures, pamphlets. There's a social media advertising guide. So if you're interested in learning how to advertise on social media, we're here to help any way possible. So we have all those resources here on our agent launchpad, ncd.com/agents. There's also training webinars on there. Once you get in, you'll select which plan you want to view. Do you want to view the NCD by Nationwide, or the NCD by MetLife, or the VSP plan? And then just click on that and you'll have access to all the marketing materials for those plans. It's also worth mentioning that this MetLife plan is not on the same enrollment portal as your prior nationwide plans. It has its own enrollment portal, and I need to add that to this slide, but I want to give you, and I'll put it in the chat. So I put it in the chat. It's enrollment.ncd.com. So you'll click that link. You'll immediately put in your agent ID, and then you'll hit submit. And that's your personal URL, how to sell this policy with MetLife. So very important link there. All right. I appreciate your time, and let me run through this really quick. I know I went quick, so if you have questions about the plans, now's the time to do so. As they come in, though, I want to hit on a couple of key points and just make sure to emphasize those. Try to make sure to see if your client's in network before issuing this policy. The in-network discount is very, very large, 35 to 50% off right off the top. So if they are not in network, these are MAC plans, maximum allowable cost plans, and pay the same amount in network as we will out of network, but likely there will be a balance bill due after the fact. And the services that are being performed for your client are not going to have the network discount applied, obviously. So likely they will pay more for their services and not utilize that network discount. So very important to try to stay in network if possible. Also, huge network discount. Can't emphasize it enough. It's one of the largest out there on the market. The $10,000 max plan, again, has implants, dentures, all the very expensive procedures a lot of carriers are not wanting to cover. And that's reflective a little bit in the premium as well. But $10,000 worth of coverage for starting at $72 a month, it can't be beat. So very strong plan, very big network, great customer service. So we're here to help any way possible, and I will start answering questions.
Jesse, one thing I would like to make is that if you are currently contracted with National Care Dental, then you are already set to sell this MetLife plan.
Yeah, that's correct. That's a great point, Cass. I appreciate you bringing that up. NCD, like I said, is a program management company. We will continue to work with carriers to bring new products to market. They may not always be dental. We're looking at other options as well. But as we bring on new carriers and new products, your contract with us allows you an ability to sell all of our products. And so you can sell our MetLife dental plan, you can sell our nationwide dental plan or our VSP at this point. I would likely, if I were you and you were looking to sell a dental plan, I would check the network, make sure your client is in network. If they are not in network with MetLife, I'd scoot over to the nationwide, see if they're in network there. It's important to try to stay in network when you're dealing with a dental plan.